Now, the cases of measles have begun to decline since the outbreak was confirmed late last year. But now parents have another viral infection to worry about. The National Institute for Communicable Diseases has confirmed a mumps outbreak, with Gauteng, Mpumalanga and KwaZulu-Natal accounting for the majority of cases. For more on this, we're now joined by the Institute's acting head of the Outbreak Response Unit, Nevashan Govender. Mr. Govender, thank you so much for joining us this evening. Now, an outbreak has been confirmed. What do you explain an outbreak to constitute of?
Thanks, Katlego. Thanks for having me. So, an outbreak is actually a more than expected increase in numbers. And in this case, with mumps, it's been a more than expected number of test positives. We do not have formal surveillance for mumps, as mumps is not a notifiable medical condition. And so we conducted ad hoc surveillance and data analysis of available laboratory data from the public sector, from the NHLS laboratories, following queries from members of the public, some alert clinicians, and communicable disease coordinators in the different provinces. And this allowed us to confirm that over the last few weeks, the number of test positives for mumps has increased to a level that we can say that it constitutes an outbreak.
Speaking of an outbreak, I mean, we are seeing an uptick of preventable childhood diseases. Many health experts warned that this may happen due to the vaccination focus shifting to COVID during the time of COVID. And we know a lot of children stayed at home for that 3 years. So that immunity gap, will we see more of these diseases now sprouting in the near future?
It is extremely likely. Many public health experts spoke to that, as you rightly mentioned. Routine services were compromised. Many, due to the lockdowns, may not have been interacting in the way that they were, not being exposed to these normal childhood diseases. And then obviously the uptake of these vaccines have created the immunity gap. We've seen it play out with measles. There have been increases with diphtheria and pertussis. And so, we have the opportunity now to close this gap by having catch-up campaigns, by parents taking their kids for the catch-up doses. So there is the opportunity for the general public to be more proactive in keeping children and themselves a lot safer.
Speaking of those catch-up campaigns and extra doses that children needed to take, I mean, with the measles outbreak, the Department of Health recommended that children go for those boosters. Did that booster, was it specifically for measles, or was it for the measles, mumps, as well as the rubella?
So the vaccine that was part of the vaccine for the catch-up campaign for measles was measles specific. And obviously, you can now tell the impact of those catch-up campaigns with the decrease in the measles cases. But the measles, mumps, and rubella vaccine is actually only currently available in the private sector. Does not form part of our expanded program for immunizations at the moment. There's a lot of consideration being taken and advice being given to the National Department of Health around including the measles, mumps and rubella vaccine in the EPI program. And I'm sure such instances may provide evidence as to why the measles, mumps and rubella vaccine should be universally available.
And speaking of that, how much time do you perhaps think it would take for that process to happen, especially now that we are seeing an uptake in many of these preventable diseases?
So it's difficult for me to comment on. There are advisory committees, and I'm sure that the Department of Health are taking all the necessary advice and considerations into account.
Speaking and going back to mumps, what can parents look out for? What are some of the signs and symptoms that a parent needs to give adherence to, especially with their young ones interacting with other children?
Of course, and it is quite difficult because before the traditional, the swelling of the parotid gland that you notice from the ear across the jawline. That can happen either on one side or both. The symptoms may be fever, malaise, loss of appetite. So just generally being unwell, and the swelling that's so typical of mumps may only present itself a few days later. Once that happens, the person or the child or even the adult or young adult would have to quarantine for 5 days because it's believed that, and evidence has shown that people can be infective or infectious for up to a week before the actual swelling occurs and up to 5 days post that.
And how is the virus transmitted?
So the virus is transmitted via salivary droplets and through contaminated surfaces. And so, your general precautions, your good hygiene practice is really the first level of protection. So you can understand why children get infected. Their general hygiene practices when they're interacting with each other may not be as great. It is a childhood disease. Lots of people are exposed or when they are quite young, and usually when you have mumps, you should have lifelong protection and should protect you from a second episode. Although a second episode does rarely occur.
Speaking of it as a childhood disease, I mean, many parents might say that I had mumps as a child. It's something that we can live through. Therefore, I won't be that serious in taking up any precaution should my child get the virus or even to be vaccinated against it. What advice would you have for such a parent? And what are some of the long-term effects that one could develop after having mumps?
So in countries where the MMR vaccine is universally available, public health authorities may suggest that an additional dose of MMR is administered to increase immunity, for added protection. There are complications from mumps. It does happen. It can lead to there can be swelling of the ovaries or testes. There can be deafness, which could be temporary and then permanent. So there are some complications that can occur from having mumps.
Sure. Lastly, Mr. Govender, we do know that Gauteng, Mpumalanga and KwaZulu-Natal are the three provinces where we are seeing a majority of the cases. Could this spread to other provinces? Is this likely in the near future?
So from the data that we have available, we have all 9 provinces with test positives. Obviously, the 3 provinces that you have mentioned have the greater proportion at the moment from the data that we do have available. So yes, there is always the likelihood that there could be increased transmission or geographical spread of transmission.
Before I let you go, Mr. Govender, just one quick question. I mean, you mentioned infertility as one of the long-term effects of having had mumps. There's also sayings that there's a drop in sperm if a male gets it and could also lead to infertility. Is this accurate?
So, look, that's not my area of particular expertise, but there is literature that does suggest that there can be some knock-on effects.
Right. Thank you so much, Nevashan, Govender, acting head of the Outbreak Response Unit at the NICD, speaking to us there about the outbreak that has now been confirmed with regards to mumps and the seriousness of ensuring that children are protected, especially those under the age of 6. Thank you so much for joining us.